Lovenox, heparin, and aspirin are all medications used to manage blood clotting, but they work in different ways and have distinct uses. Lovenox is low molecular weight heparin. Lovenox works by inhibiting clotting factors, particularly factor SAR, and to a lesser extent thrombin. This helps prevent the formation of blood clots. It's commonly used for preventing and treating deep vein thrombosis, pulmonary embolism, and for preventing clotting after surgeries such as knee or hip replacements. It's typically injected under the skin once or twice daily. It has a more predictable response and doesn't require as frequent blood monitoring as heparin. Heparin also inhibits clotting factors, primarily thrombin and factor XR, but it has a more complex mechanism compared to Lovenox. It's used in hospital settings for conditions like DVT, PE, acute coronary syndrome, and for preventing clotting during surgeries. It's also used for dialysis procedures. Heparin is usually given through an intravenous line or subcutaneously, and its dosage is carefully monitored through blood tests to ensure proper anticoagulation levels. Heparin is reversible with a drug called protamine sulfate, and it is often used in acute settings where more rapid and controlled effects are needed. Aspirin is a non-steroidal anti-inflammatory drug. Aspirin works by inhibiting the enzyme cyclooxygenase, which in turn reduces the production of thromboxane A2, a molecule that promotes platelet clotting. This makes aspirin an antiplatelet agent. It is primarily used for cardiovascular conditions, such as preventing heart attacks, strokes, and in people with a high risk of blood clots. It is also used to reduce inflammation and pain. It is usually taken orally in tablet form, often as a low-dose aspirin for heart protection. Aspirin is available over the counter, is easy to take, and is widely used for long-term prevention of clotting. So how are they different? Lovenox and heparin are anticoagulants that inhibit clotting factors, while aspirin is an antiplatelet agent that prevents platelets from clumping together. Lovenox and heparin are primarily used to treat and prevent blood clots in acute and surgical settings, while aspirin is used primarily for long-term prevention of heart attacks and strokes. Lovenox and heparin are typically injected, while aspirin is taken orally. Heparin requires frequent monitoring of clotting levels, while Lovenox generally does not. Aspirin does not require routine monitoring, but may need to be adjusted based on individual risk factors. Why prescribe heparin versus Lovenox? Heparin is often preferred in acute, severe conditions, like massive pulmonary embolism, acute myocardial infarction, or unstable angina, where quick, immediate anticoagulation is required. In these cases, heparin's rapid onset and reversibility with protamine sulfate make it a more suitable choice. Heparin's effects can be adjusted in real time based on laboratory testing, allowing for precise control over anticoagulation levels. Heparin is commonly used in surgeries, particularly during cardiac bypass or dialysis, where rapid and controlled anticoagulation is essential.